So we're going to talk about fat grafting a little bit today. So we've had a lot of patients come in that are unfamiliar with what fat grafting is and what exactly we're talking about. So often patient can come in just for fillers. Patients lost volume in the mid-face, or maybe they want a little bit of extra volume in their lips or cheeks. And so we can use off-the-shelf sugary proteins like Voluma or Restylane or Juvederm. These are HA type filler products, but often a patient wants something that's a little bit longer lasting. So maybe they've done a couple rounds of fillers and they like that, but they want something a little bit more permanent. And so often we will take the patient to the operating room. I typically find that it's a little bit more comfortable if the patient goes off into a little bit of a twilight sleep, and then we can borrow a little bit of fat from the patient's body. Abdomen is a common place, or outer thigh. And then we can take that fat and basically transplant it to areas of the face that we'd like to add volume. So people often say, well, oh my gosh, maybe I'm really thin, I don't have enough fat. To make a big contour change in the abdomen, flanks, love handles, typically you're taking off hundreds and hundreds of milliliters. We would never transplant that much to the face. So, you know, when we're talking about buying, say, a vial of Juvederm, that's 1 ml or 1 milliliter. So, you know, you're only needing small volumes of the fat transferred to the face to make a big difference here. Whereas, you know, typically if you're taking off a small amount, you're not going to notice, you know, big change in the donor site. Patients will often ask, well, you know, how long will this last? Well, fat grafting essentially is permanent. So this is a free graft. So whenever we take it from the donor site, maybe, like I said, the love handle or the abdomen or the flank, and put it into the face, only a percentage of that graft is going to live, and it's never 100%. Typically, I quote patients that most of the time, you know, it's maybe around 50% or so. Certainly have patients that more will take, and certainly have had patients that less will take. So there is some variability to that, and often we'll go back in multiple sessions if the patient really wants to tweak it. A question I've often had was, why don't you just overfill, and then basically if you only get 50% of that, then you hit the mark just right. Well, I would never want to do that, because if you overfill and then you do get more that would take and survive than you would anticipate, then you would get, you know, lumpy and bumpy parts of the face where you had overfilled the patient. So we don't typically like to do that. Now patients often ask, well, as I age, will the graft age with me? And the answer is yes. Typically the fat will take on the fat characteristics of the place that it's transplanted to. And so as we know, as we age, we lose facial fat. So this fat will age just like the other fat in the compartments of the face. And so then patients will often ask, well, what happens if I gain weight? Well, if you gain weight, the fat that you put there could make the face look fatter, certainly, just like the fat that's already there. So, you know, that's typically not a significant problem unless the patient puts on a tremendous amount of weight. So we're talking, you know, somewhere around 50 to 100 pounds. So if the patient's weight has been stable for some time, then we would typically say these type patients are good candidates for fat transfer, fat transplant. So if you have any questions about fat grafting, please let us know. I think it's a great technique to add volume back to the face, and do it almost on all my facelifts to give a more natural result, so that you don't have to pull nearly as tight to be able to efface these wrinkles. You can add volume back with fat grafting. So thanks so much, and if you have questions, let us know.